We should realize that health information management is a very critical aspect in public health because, as we have always said, we need data to make informed decisions, and our interventions in public health should always be evidence based. And this evidence can only be got from data that is prepared very well. It is acquired in a very good manner and analyzed very well and reported to the relevant authorities in a way that can enable us to retrieve it and use it for our evidence-based interventions. So today we are going to focus on this health information management. Remember that we introduced health data in this module where we looked at the various sources of the health data and how we can gain that health data. So today we are going to, in this session, in the second session, we are going to focus on this health information management, and we shall look at the various ways of managing this health information, and we shall see the challenges that we always face, the standards that are always used to communicate this health information, and then we shall also see strategies to improve this health information management. So first, the definition of health information management is that it is the acquiring, analyzing, protecting the medical information to support quality patient care, efficient healthcare operations, and evidence-based decision making, like we have said. So it involves the collection, the storing, the managing, and the dissemination of data that is generated in health settings. So the health information systems provide a structured approach to handling health information, as a very great importance of these systems, which ensures accuracy, accessibility, and privacy of patient data. So we realize that in these health information management systems, there are always those standards, guidelines, and regulations that are always observed in this collection, in the storage, and the accessibility of this data, and make sure that this data is accessed by authorized personnel, and there should be privacy of the patients in terms of their identifiers. People should not be able to identify these patients and their illnesses, so that their dignity is preserved. Also, another importance is that these systems are critical in healthcare planning, policy development, research, and public health initiatives. Yes, you cannot plan without evidence. You should plan with evidence, and also policy development requires that we have facts for us to convince people who are going to put in place policies. For example, to prevent infectious diseases, to prevent to reduce maternal deaths, we should be having numbers. These facts and statistics are only got through careful management of information that is gathered in health settings, and that is where the health information management systems comes in. Research, of course, relies heavily on this secondary data instead of going into the population to collect data of, for example, maternal deaths. You can always use secondary data that is collected from these health information management systems. So the components of these health information management systems include the data collection, which involves gathering the relevant health data from various sources, and this could include electronic health records or the records that are that have been electronically captured by using electronic devices, not the manual ones. Then you can also use medical forms and diagnostic test forms. Then another component could be health data storage and organization. So after you've collected the data, you need to store it in a secure and standardized manner to facilitate easy retrieval or easy access and analysis. So there are always standards that guide us in the storage and the organization of this health data. Then after you've stored, you do not want to just store and organize it, but you do that for data analysis. And this data analysis will provide meaningful insights. It will identify the trends in that data and ultimately will support decision making so as to improve the overall health of the people that this data is collected from. Then the other component, number 4, is health data privacy. It's a very important component that helps to protect the patient privacy and ensure that this health information is secure. The last component of this health information management system is data exchange. Yes, we need to exchange data between different systems of this health information management system so that we can always help each other. And this is is all about facilitating the secure sharing of health information between healthcare providers, patients, and other authorized entities. Yeah, so sometimes you want to refer a patient to another or a higher health facility, but you do not want them to carry the cumbersome medical records. So you can always share this data through these health information management systems. Yeah, and there are always guidelines that guide that so that the patient privacy is protected and you speak the same language. The person that you're communicating to, this patient's history should be able to understand what you're communicating. So the benefits of this health information management system include improved patient care, whereby it promotes accessible and accurate health information and makes informed and helps professionals in the health sector to make informed clinical decisions, which enhances patient care and outcomes. Like I said in the previous example, which I've just given, that if you are referring a patient to a higher health facility and you transfer their electronic health records through a system, this health information management system to that higher health facility, they are able to get this person's clinical history or their complaints about their health in real time, and this means that they will be able to make informed decisions and the patient care will be quicker. Then enhanced efficiency, because this HIMS reduces paperwork, it streamlines workflows and provide and improves the efficiency of healthcare processes. Yeah, because paperwork is always a thing that takes a lot of time, and sometimes there is always loss of this paperwork. But since we have this health information management system, then the paperwork is reduced, and you can always be sure that the efficiency and delivery of healthcare will be quicker. Then decision making is now data driven, or it is evidence based due to this health information management system. So we realize that because of analysis of health data, it will provide valuable insights of health, to the healthcare administrators, the policymakers, and researchers so that they can always make evidence based decisions with data, accurate data that is well collected, well organized, and stored, and expertly analyzed. Then you can always be sure that your interventions or decisions in the healthcare delivery or services will always be evidence based. Then we have continuity of care as another benefit of this health information management system, whereby a sharing of patient information will ensure that there is continuity of care, and that has been mentioned in that example of referral. Then patient engagement. These systems empower patients to access and actively participate in their healthcare, which promotes patient engagement and self-management. Yeah, and this is evidenced in the management of non-communicable diseases like diabetes, like hypertension, and other chronic illnesses, whereby the patient is now aware of how they are, and they know maybe their the information about their health, which can be fed into these electronic health records, and then they can always engage with these healthcare providers. And once they engage with them in a frequent manner, then they are able to take responsibility of their health, and this empowers them to take charge of their health inevitably, because they feel they are taking part in their own management of their health. So it promotes this patient engagement. But as any other good thing, this health information management systems has challenges, and one of them is data privacy and security, whereby safeguarding patient privacy and ensuring that data is secure against unauthorized access is always a challenge. Yeah, anything that exists on the web or on the internet and is always liable to being to being accessed by unauthorized people. So there are always these challenges, but like we have always said, every challenge always creates an opportunity for us to provide a solution. So we must design uh, systems that are always very, very hacker proof, so that they are not accessed easily by hackers or unauthorized personnel. Then the other challenge is interoperability, which and interoperability makes the exchange of this health information possible, but in some cases or in some settings, this interoperability or the exchange of this health information across healthcare systems and platforms is always a challenge. Then data quality, making sure that we have accurate, complete, and reliable health data that is fit for the intended purpose is not always the case in most settings. Yeah, and this could be due to lack of training by the of the people who are collecting the data, or who are organizing it, or even those who are analyzing it. So this data quality in some case settings is always a problem. Then system integration, integrating this novel or new system of health information management system with the existing infrastructure is always problematic. Yeah, you find sometimes you want to collect data from those local health facilities, and they do not have maybe desktop computers, they do not have any infrastructure to make this possible. Sometimes even the electricity or the power to run these electronic devices is unreliable. So it is always also a challenge. Then staff training and adoption, training the healthcare professionals and staff to use and adopt these health information management systems effectively is always a challenge. Yeah, sometimes some of them are too conservative to change, while others may need motivation in terms of money, which is not always available to make this training possible. So the what we see in the future of this health information management system is a lot. We envision a lot in as far as health information management system is concerned. And one of the things that we envision is interconnectivity, where we predict that there will be increased integration and interoperability of exchange of information so as to enable this collaboration and data exchange between different health systems. We also envision artificial intelligence and analytics coming in to make this HIMS a better tool for predicting outcomes in health and supporting personalized medicine. Then telehealth or remote monitoring, uh, which enables remote healthcare delivery. Again, it is common. It will be common in the management of non-communicable diseases, whereby you can be home having diabetes or having hypertension, and your healthcare provider will also be in their office, and they will give you instructions on how to manage your health. You do not have to travel to the health facility, or he does not have to come to your home to give you this advice. Or sometimes you could have undergone a trauma which requires you to undergo physiotherapy during your recovery, but your physiotherapist can deliver these drills from their home to you in the comfort of your home. So all this will be the future of this health information management system. Then we also envision blockchain technology, which enables decentralized health data management and consent management, but also makes the health information management systems more secure. Yeah, this blockchain technology is commonly used in cryptocurrency, like in the in these Bitcoin technologies. So it enables those systems to be more secure and not prone to hackers. Then patient empowerment is also a future trend that we envision, which will empower individuals to manage their health information and engage in their care. And we have already talked about that. So health information management systems would not make a lot of sense if there is no exchange of information. So in uh, in these systems, we need exchange of information between healthcare providers or organizations. So it is the electronic sharing of health related information among healthcare organizations, public health agencies, and other authorized entities. And it facilitates the secure and seamless exchange of the patient health records, the test results from the lab, immunization data, and other relevant health information that has been collected. So the importance of this health information exchange in public health is that it enables providers of healthcare and other public health agencies to access comprehensive and up-to-date patient data, which improves care coordination and decision making. Yeah, like I said, a patient might not be handled by only one healthcare provider. Yes, so there could be at one point, if maybe you have had a fracture on your way to work, and you were handled by a first aider. So this first aider needs to communicate to the nurse who is at the emergency department on in a hospital. So this relay of information between you, the first aid, and the and this NAS will be enabled and will be made faster by this health information exchange. But this NAS also needs to communicate with the people in the theater in case you need a surgery to manage that fracture. They also need to communicate with the people who are doing x-rays, and after they have done that x-ray, it needs to be relayed to this system, so that all that needs to be compiled and brought together in the system, and 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 everyone needs to be following up on each other. Okay, and the exchange of this information on the patient is enabled with this health information exchange. So and so ultimately you will have improved care coordination and decision making. Then health information supports population health surveillance, disease tracking and monitoring. It which helps public health agencies identify the trends, outbreaks, and areas for intervention. So there is always routine and periodic collection and organization of this health information, and sometimes it is on those uh, infectious diseases or those disease or epidemic prone diseases. So whenever there is a rise in the cases beyond what is expected, then it facilitates this surveillance that we are talking about, and it makes these public health agencies to know that there is an outbreak or an epidemic very fast, so that they can put in place these control measures to to combat this outbreak. Then it also enables rapid information sharing during emergencies, which facilitates coordinated responses and resource allocation. Yes, again, in emergencies, there should be this coordination and there should be communication sharing. So, this health information exchange will enable that to be rapid, and this is always essential in emergencies. We do not want to waste any time. So, this health information exchange comes in handy to do that. Then another part of this health information exchange is interoperability, which is the ability of different health information systems and technologies to exchange and use data seamlessly. So it allows the integration of data from various sources, ensuring that there is data consistency, accessibility, and usability across systems. So, like I was saying, there could be a lot of systems, from maybe the people in the lab to those at the emergency department, others in the wards, others in the community, others in the pharmacy, and they have different systems. So the fact that they are able to exchange information seamlessly between each other, and each of these people is able to use the information of the other person, and they are communicating using the same language, is what we are calling interoperability. And this interoperability is always managed or guided by standards and frameworks, and these basically put in place guidelines on how this exchange of information should be done, and they include the health level 7, which is the which has been abbreviated as HL7, and it is widely used for exchange, integration, sharing, and retrieval of electronic health information. Then there is also the FHIR, or the FHIR, which is the Fast Healthcare Interoperability Resource, and it is a modern and flexible standard for healthcare data exchange designed to facilitate this exchange of information in the healthcare setting and support innovation. Then there is also the CCDA, which is the standard for structuring the clinical documents, enabling exchange of patient summaries, discharge summaries, and other clinical reports. So this is more of the one that facilitates this exchange of these clinical documents. So the challenge in exchange of this health information is that we have data standardization, whereby there are always variations in data formats in the different systems of this information. So you find that, for example, a healthcare facility at a lower level has a different system from the one at the higher level. So if you have at the clinic level a different system from the one at the hospital level or a higher level, then this data standardization is always a challenge. The coding systems and the technologies used, so it hinders the smooth data exchange and interoperability. But also another challenge is privacy and security, whereby protecting patient privacy and ensuring that data is secure during exchange requires those robust security measures and adherence to privacy regulations, which is always a challenge. Yeah, sometimes the security measures that should be robust need you to hire some IT teams, which might be expensive for some health care facilities. Then the technical and financial barriers are obvious because for you to implement and maintain these systems, which enable exchange of health information, it will be technically complex and requires a lot of resources, which are not always present in our African settings. So, how do we promote this exchange of health information? Because we have realized that it is very essential. We must adopt interoperability standards, which I've looked at, and these will be encouraged through standardized data formats and terminologies across healthcare systems and public health agencies. So there should be standards that everyone in this chain of sharing health information has. Yeah, we should be speaking the same language. When a health facility at a lower level communicates something, it should be understood by the health care facility at a higher level. Okay, so that exchange of health information is seamless. Then collaboration and partnerships will also be able to to promote this health information exchange, and it can exist between the healthcare organizations, public health agencies, and people who create these systems, or the ones that we are calling technology vendors, so that they can always develop and implement interoperable solutions. Yeah, they shouldn't make complex systems which will not be understood by the laymen who are who are delivering this healthcare. Then policy and regulatory measures. With policy, of course, in place, then promotion of this health information exchange is always faster. So, developing and enforcing these policies and regulations that prioritize health information exchange in public health is a very critical aspect of promotion of these interoperability initiatives. So, we need also look at the importance of health management information system in quality improvement. Why is the management of health information important in promotion of quality in health? So it is important because it provides accurate and timely data, which helps healthcare organizations to make informed decisions to improve quality of care. So, and that is self-explanatory. Then it also enables tracking and monitoring of key quality indicators, which allows organizations to identify areas of improvement and measure the progress. So you can imagine monitoring, uh, if you are monitoring family planning success in a certain area, and you are using these health management information systems. So if you are focusing on a particular family planning method like IUDs, which are intrauterine devices, so you can always see the trend of how those intrauterine devices are being used by tracking, by monitoring the numbers of people who are uptaking those IUDs. And if they are not uptaking them, it will also be noticed through these information systems, and then that will enable you to identify those areas that need improvement. And of course, through that, you should be able to measure the progress of uptake of your intervention. Then the the health management information system also facilitates the collection and analysis of data on best practices, leading to implementation of evidence-based interventions for quality improvement. Yeah, so you can always collect data using these health information systems, and it will help you to make evidence-based interventions. So the components of this HMIS include data capture and collection, which involves efficient mechanisms of collecting the data, for example, by use of electronic health records or using electronic devices to record the health information from patients. Clinical forms and surveys are also used to collect data. Then data storage and management, using systems and databases to securely store and organize health related data. Then after you've stored, you need to analyze and report. So all these are the components of HMIS, but we can also not forget the fact that after you've collected, after you've organized, after you've analyzed and reported, you also need to disseminate. So dissemination includes strategies of sharing information with relevant stakeholders to ensure its effective use for decision making and quality improvement initiatives. You cannot just collect this data and keep it to yourself. You need to relay it to the relevant authorities, either the public health organizations that need it or the policymakers, to make those informed decisions and to improve health care delivery. So the role of health management information system in quality assurance include monitoring and evaluation. Ultimately, these systems enable continuous monitoring of quality indicators and evaluation of interventions. Whenever there is an intervention or program in place, you must use these systems to collect data and help you to see whether your intervention is working or not. Then performance benchmarking, they facilitate the comparison of performance against established benchmarks and standards, identifying the gaps and areas for improvement. Yeah, so there are always, of course, benchmarks either set by the World Health Organization or CDC or other organizations that are big in this health, in public health. So you can always use this HMIS to benchmark with those with those standards that have been put in place. Okay, so you collect your data and you compare it with those benchmarks. For example, if the World Health Organization proposes that there should be less than 30 maternal deaths in a year, and using your health management information system, you find that in your region you have more than 30, then that means that there is a gap. There should be something that is done to correct that. Okay. Then feedback and corrective actions provides feedback on quality performance, allowing organizations to implement corrective actions and improve care processes. Yes, through these health management information systems, you're able to get what is taking place on your intervention. So that will be feedback whether you are doing well or not, and then you can always put in place corrective measures to improve. So examples of how these systems are applied in quality improvement, we have tracking and reducing medication errors, monitoring infection rates, and implementing interventions for infection control, analyzing patient satisfaction to identify areas for improvement, and monitoring and improving adherence to clinical guidelines and protocols. So these systems are always interactive in nature. That's why we have sometimes even the patients being asked some questions about the satisfaction. Sometimes they might not be the ones to access these systems, but the data that is collected from them is fed into these systems, and we can always use such data to analyze whether the patients are being satisfied by the care they are receiving from the hospitals or not. Okay. Then infection rates, of course, that is also very, very vital, and it can be achieved using these systems. You can always track a disease's infection rate using this health information management system, because every disease case is always captured using these systems, and it tells you whether the infection rates are increasing, whether they are reducing, or whether they are constant. So that is the beauty of using these health management information systems. The challenge is that we always have data quality and accuracy. Sometimes the people who collect this data, who organize it, are not accurate enough, and sometimes it is not complete, and that makes it unreliable. Then the sharing of this information or interoperability is also a bit challenging. Staff training and capacity building has also been a challenge, and once the staff is not trained on how to use this HMIS, then it is always hard to get even this data in the first place. Yeah. So we need strategies to improve HMIS so that inevitably our quality in healthcare can also improve. And these include stakeholder engagement, whereby we need to involve key stakeholders in the design, the implementation, and monitoring of HMIS. Key these key stakeholders could include even the healthcare providers themselves, the healthcare staff. They need to be involved. They need to know. They need to give in their input on how to design and implement these systems. Especially on the design, it should be user friendly for them to always navigate through very easily. Then training and support, which entails providing comprehensive training and ongoing support to healthcare staff so that they can use these systems very well. Then continuous improvement, even after training, you need to always continuously improve their skills, because sometimes they might not remember some things, but through these continuous improvements or through these continuous development sessions, then they are able to give you feedback, and they are able to learn new skills about this HMIS. So another critical aspect of HMIS is leadership. Leadership is critical in health information systems, and it is the ability to guide, influence, and inspire individuals and teams to take advantage of information systems to achieve organizational goals effectively. So, the ability to guide, to influence, and inspire individuals in a particular organization or in a healthcare facility to take advantage or use fully these health information systems is what we are calling leadership in this context. So, effective leadership is very essential for strategic planning, decision making, and change management, and fostering a culture of innovation and collaboration, which are very essential aspects of health information systems. So, the characteristics of effective leadership in health information systems include vision and strategic thinking. So, leaders should have a clear vision of how we are going to take advantage of these information systems so that we can improve healthcare delivery and outcomes, and the ability to develop and execute strategic plans. Yeah, very essential in an effective, efficient leader. Then communication and collaboration, which will enable the leader to effectively convey the goals and expectations and changes to the stakeholders and foster collaboration among the diverse teams in health information systems. Then change management. It should be very skillful. A leader should be skillful in managing and leading through these changes in the health information systems, because these systems are always dynamic. There are always changes to meet the needs of the ever-changing technology world. Then there should be this aspect of change management. How do you manage change? How do you convey your message to the people that this is changing? How do you overcome resistance? Because whenever there is change, there are always people who are going to resist change. So you should be having that characteristic of change management in a leader, so as to ensure smooth adoption and implementation of these information systems. Then technical competence, a leader in this health information system should have that solid understanding of this health information system. It should be on their fingerprints. They should be able to navigate around this system. They should not be learning from the people that they are supposed to teach. Okay, they should be having the knowledge of this health information system, how it works, how to fix some problems if they arise. Everything should be at their fingertips. Emerging technologies, how to improve it. The data management principles, so as to make those informed decisions and provide guidance to the people that are going to use this health information system. So the roles of these leaders include the strategic planning that we talked about, which will entail developing long-term and short-term goals, objectives, and strategies to effectively use these systems in healthcare organizations. Resource management, you have to allocate resources such as budgets, staff, and technology to support and implement the maintenance of these systems. Yeah. Yeah, so it is a very, very essential role of these leaders. Then another role is stakeholder engagement, which involves building relationships and collaborations with stakeholders who are essential in health information systems, and these include healthcare providers, the IT teams, the vendors of these tools. We also have administrators, and then all this engagement will enable alignment and support for these systems. Then performance monitoring is a very critical role and responsibility of these leaders, which involves tracking and evaluating the performance of these systems, measuring the outcomes and identifying the areas that need to be improved on. We also have continuous learning and innovation. A leader has to be a good learner, should be innovative and creative, and should be able to promote that culture of continuous learning in the people that they are going to relay these skills of information system management to. And they should stay updated with emerging trends and technologies, because, like I said, this is a sphere which is always dynamic, ever changing and evolving. So you should be able to stay in touch with these trends and technologies and foster innovation and use of information systems. So the styles that can be employed in these health information systems could include transformational leadership, which entails inspiring and motivating the teams to achieve higher levels of performance and innovation. But you can also use the participative leadership, which will include involving all the stakeholders in decision making and promoting collaboration and shared ownership. Then servant leadership will mean that you will put the needs of others first and emphasize support, empathy, and service to team members of this health information system. But of course, we are not talking about these different leadership styles to show you that you only have to use only one leadership style. You can always use all of them, both of them, some aspects of each of them, so that you can have that cutting edge leadership style, so as to deliver this quality health information system leadership. So the challenges in leading of this health information system include keeping up with technological advances and their potential impact on healthcare and information systems. Yeah, it is always challenging sometimes, especially if you do not have that technical know-how, and then overcoming resistance to adopting new systems, processes, and workflows. Like I said, whenever something new is coming, new technology is coming, you need to be a change manager. But sometimes overcoming resistance from the people that you are going to preach your gospel of health information management can be challenging. Okay, that's why you need the other skill of managing change. Then ensuring compliance with privacy regulations and protecting sensitive health information is always also a challenge. Yeah, you might want to comply with privacy regulations, but a member on your team might not take that seriously. So those are the challenges in this leadership. Then facilitating collaboration between IT teams, clinical staff, and administrators, since they always have diverse perspectives, interests, and priorities, is always a challenge as well. But there are always also strategies to improve this or to make leadership in HIS effective, and they include investing in leadership development, which will mean that you provide training, mentorship, and professional development opportunities for the leaders to enhance their skills. Yes, this should be done either by the public health organizations or by the facilities themselves. They can sponsor one of theirs to to do this mentorship, this training in health information systems, and then foster a culture of innovation, encourage creativity amongst your team, risk taking, learning from failures, and drive innovation in health systems implementation and utilization. Because in technology, you have to be a risk taker, you must be creative, you must be innovative, you must learn from your failures. So, all this is to foster that culture of innovation, which is essential in health information systems. Then building collaborative relationships. All stakeholders should be engaged in the planning, in the development, in the execution of all these health information systems. So make sure that you are on the same page, you speak the same language. And by speaking the same language, I do not mean either English or or any other language, but I'm talking about being on the same page, moving together, you know, which we are calling alignment. You move together every step of the way in health information system, and this will encourage ownership and responsibility by all the team members. They know that they have to play their roles right and achieve the overall of delivering healthcare to the patients or to the community in real time in an efficient and effective manner using these health information systems. So health systems are integrated in these health information systems, and they are these health systems that we are talking about are the interconnected network of organizations, institutions, resources, and individuals in delivering healthcare services to the population. And they encompass various components, including healthcare providers, facilities, financing mechanisms, information systems, and governance structures. So the roles of these people, uh, of these systems, include the generation of the vast data that is used in health information systems, such as the diagnosis, the patient encounters, treatments, and healthcare transactions. All these huge sums of data are collected by these health systems, but they also go on to provide the infrastructure where these health information systems arise from. So this infrastructure enables capturing, storing, and managing health related data, and it includes the electronic health uh, records, the clinical databases, and administrative systems. So the health systems also facilitate the flow and exchange of data, which we call interoperability amongst the various healthcare settings such as hospitals, clinics, labs, and public health agencies. And the other role that they play is data utilization. They are the foundation of utilizing health information to support decision making, quality improvement, research, and public health intervention. So this data that is collected using these systems is it goes back to help these health systems themselves. Okay, so you find that you've collected data on maternal health using these systems, and you've discovered that there is a gap in maybe the availability of mama kits, which are supposed to be given to expectant mothers to manage their their delivery. So inevitably, if you find that gap, then you're going to put in place an intervention that will provide more mama kits to that health facility, and it will help this health facility which gathered that information. So this is what we are calling that data utilization. So the components of health systems in this whole thing is they have the healthcare providers, or they include the healthcare providers, which are the hospitals, clinics, primary care centers, labs, and other healthcare facilities that generate and collect health data. Then there is the workforce, which includes the nurses, technicians, and other healthcare professionals who interact with patients and contribute to data generation. Then we have the information systems that consist of the electronic health records. We have clinical databases, registries, and other digital systems that are used to capture, store, and manage health data. The other components include the financing mechanisms, which enable the smooth running of these health information management systems. Then governance structures that will put in place policies, regulations, which are responsible for overseeing and coordination of these healthcare services that are also essential in promotion of privacy of the patients from whom these this information is collected. They are also essential in putting in place standards of exchange of this health information. So those are the components of the health systems when it comes to health management information systems and their roles. So we look at the data flow in the health systems within the HMIS. How does data flow, or how is data managed so as to achieve effective health management information systems? So it begins with data generation, whereby data is generated from patient during patient encounters, during laboratory tests, imaging studies like X-rays, CT scans, MRIs, all those imaging and ultrasound scan, and also administrative processes. Then from that, we have data capture and storage, whereby data is captured either using electronic health records and laboratory information systems and then stored in databases, which should be secure. And then from storage and capture, we have data integration and interoperability. So data from different sources within the health system are integrated and made accessible or shared to create that comprehensive view of the patient and population health. Like I said, you have a patient, they have come to your hospital or your clinic. They need services from the lab, they need services from the theater, they need services from maybe any other point in that health facility. So whenever they go to each point of this health facility, their data is captured into their various systems at those various points. But this sharing and interoperability means that that data, since it is of one patient, it needs to be brought in one place so that this patient is managed seamlessly. Their management is made quicker and more efficient. So that is where data integration and interoperability comes in. So after that, we have data analysis and reporting. The data is analyzed, transformed into meaningful information, and used for reporting, monitoring, and decision making at various levels of the health system. So benefits of doing this integration will include allowing comprehensive capture of the patient health information across the different healthcare settings, which will improve the completeness and accuracy of data. Okay. Then integration also enables seamless health information exchange between healthcare providers, which promotes coordinated patient-centered care. Yeah, they are able to coordinate with each other and advise each other on how to manage the patient better. Then integrated health systems also provide that holistic view of the patient health, enabling better informed clinical decision making, resource allocation, and policy formulation. The challenge is in integrating these health systems includes data standardization. Like we said earlier, sometimes you find these various points of that health system use different data formats. So integration is always a challenge in that case. Then also another challenge is privacy and security. Protecting patient privacy from malicious people might also be challenging during the sharing and exchanging of health information. Then technical infrastructure, sometimes the availability and compatibility of technological infrastructure across these healthcare settings may pose challenges. While a higher health facility might have all these infrastructure in place, all these computers and everything, power running smoothly, these lower healthcare settings might not have the power running smoothly, and the exchange of this information might be challenging. Then governance and coordination, establishing effective structures to coordinate these and facilitate data collaboration sometimes might be challenging. So what we can do to improve this integration could include implementing standardized data models so that we all speak the same language. Person at the lower level of this health system should be able to communicate in the same language to the person at the higher step in the health system, so that we have this interoperability in place to ensure seamless data exchange. Then robust data protection measures so that the patient privacy is kept in check by use of encryption techniques, access controls, and adherence to those privacy regulations, and then providing training and support to the healthcare providers who are collecting this data, and even the IT personnel that are developing these systems and even doing data management. So everyone should be trained, and this training should not just be a one-off thing, but a continuous development kind of thing. Routinely, they should be trained again. You should be able to get feedback from them on the challenges they are facing on use of these information systems, so that you can tailor your next training to face to solve such challenges. Then lastly, we need to promote collaboration among healthcare organizations, IT vendors, or the people who are making these systems, and then the policy makers. And such collaboration, like we have said, will go a long way to promote uh, i- information sharing between all the stakeholders. We'll make sure that every stakeholder has a say in development, in implementation of these systems, which will ultimately lead to the promotion of better health management information systems. Yeah. So in conclusion, we realize that health management information systems are very important in the gathering of information from the patients, but also the community. And this helps us as public health professionals to make informed decision in promotion of better health in individuals and in the community at large, and promotion of good data collection, good data organization, and analysis should also be our role, so that we can always take full advantage of these systems to make our healthcare system better. Thank you so much for your time, and I will catch you on the next one.